The individual receiving direct neurofeedback sits in the treatment office on a chair of normal height. Any long hair is tied or clipped up to be out of the way of the neck, allowing access to the C7 vertebra prominent at the base of the neck. Any loose hair around the ears also should be pulled back and secured. The skin is then prepared with a mild exfoliant gel applied to the sensor sites. This ensures a good connection for the current to reach the skin of the patient most effectively. When the skin prep gel has been cleaned away with rubbing alcohol, the conductive paste is then applied to each site. The sensors are then applied. Standard procedure is to apply 2 on the temple and forehead, 2 at the mastoid bone behind the ear, and 1 at the base of the neck. Make sure that the client understands that they have an active role in their own session. If they do not report any of the standard responses to the microcurrent, then there is a risk of overstimulation. The most sensitive of clients will sometimes feel the response to the sensors even before the software has been activated. It's very important that those clients pay very close attention to their own response. The core approach to applying stimulation is very simple. Stimulate the client until they respond. Responses can be almost any change at all. Commonly, a client might feel relaxed or feel like their senses have opened up. Psychosomatic sensations like heaviness or tingling in the feet or hands can occur as well. Remember, it is better to start with a very small stimulation and work your way up to stronger stims. Stimulate for the duration of the protocol or until the client gives feedback that causes the practitioner to deem it wise to stop. Once the protocol is complete, the sensors are removed and the skin and sensors are cleaned. The client has now been properly administered stimulation. Before they head for home, it's important to help them understand what they're likely to encounter and what they should be watching for. In our next video, we'll cover that follow-up.